Good morning. Good morning. Everyone should be excited today. Today is the first day of school. Let's warm up with some Mr. Chuck Berry School Days.
Up in the morning and out to school. The teacher is teaching the golden rule. American history and practical math. You study them hard and hoping to pass.
How many of you remember that song? Sometimes we have to play songs to get motivated. Okay, now that I have everybody's attention, how many of you remember what your school nurse looks like, as well as her name? You remember what type of uniform she wears? A white, crisp uniform with a trifold hat? My reason for asking is, now school nurses have been delegating their responsibilities to lay personnel, dispensing Band-Aids, medications, inhalers, nosebleeds, and ice bags. Acute care nursing within a school system, there are many types of services that are being offered. We have students with ventilators, tracheotomies, G tubes, gastric tubes, as well as dependent on oxygen therapy. We have students with DNRs, do not resuscitate. We administer blood products. And we also give life-saving injections. I, myself being a parent, decided it was time for a change. So I decided I was going to be a school nurse. I don't remember exactly what my school nurse, and she did not appear like she was really working hard. So I figured, hey, summer's off, no holidays, retirement plan, sick days. I can do this. Surprise, my student. Her name is Jessica. Jessica is ventilator dependent. She's on oxygen. She has a tracheotomy. She's on G-tube feedings twice a day, as well as getting special transportation to and from school. Jessica is like any other student. We just don't know about. I gave all this up, 12-hour shifts at the hospital, to now do this in a school setting? Yes, this is true. Jessica is an AB honor roll student in a normal classroom setting with no modifications. Jessica and I have been together for 5 years. Jessica is like many other students that we do not know about in our school system that requires a lot of medical attention. Let's briefly review what we'll talk about today. We'll talk about the types of students that we service in the school system. We have students that are on special needs. We have students that have DNRs, and we have students that require the 1973 Rehabilitation Act. Acute care is defined as Table's medical dictionary as health care delivered to a patient in an emergency room or hospital setting that is short-term, not long-term, but generally not chronic care. The state board mandates that a registered lead nurse can delegate certain responsibilities. Proper training is an essential with these types of students. We are providing services for children who have seizure disorders. A second is a matter of essence. It's a life-saving procedure. They can stop breathing at any time. A proper trained school nurse is very important. A diabetic students are either stable or they're not. Constant communication with the doctor and endocrinologist is very important. The endocrinologist's main responsibility is to the patient, and on occasion the doctor will order glucagon, which is an injection which is administered intramuscular for low blood sugars. It is essential, again, timing is an asset as well as training and proper assessment. Our children with bleeding disorder like platelet dysfunction, these children have uncontrolled bleeding, and they require emergency medication, IV fluids, as well as DD-AVP. This drug shortens the time of bleeding with a patient with mild hemophiliacs or von Willebrand's disease. We have several children that are within our school system that are functioning within their best optimal potential. We have children with cancer, with spinal bifida, hydrocephalus, as well as many other comorbidities. The school system provides many multiple services, as well as catheterization, tracheotomy care, suctioning, gastric tube reinsertion, and insertion, as well as gastric feedings, invasive procedures, and techniques. Sometimes we receive telephone orders for a licensed prescriber. These services are only provided by a registered nurse, which is delegated and mandated by the State Board of Nursing. Due to comorbidities, some students have a DNR, a do not resuscitate. And these do not resuscitate, we thought we only had to deal within the school system. But sometimes we have to look at the best interest of the student. In saying that, let's look at the 504. The 504 is a rehabilitation act that was designed for children with disabilities or comorbidities that enables them to provide or receive such services within a school system. They're not discriminated against, their civil rights are not being violated, and their diagnosis meet their requirements. In closing, I hope that I have removed the veil from your eyes because school nursing is moving into the 21st century. Acute nursing is within the school system. There are many types of students that are being serviced and services are being provided for. School nurses have entered the arena of ventilators, tracheotomies, gastric tubes, and as well as administering life-saving injections. I welcome you to the world of school nursing.